It's our job as health professionals to serve as community leaders and really drive the change to increase access to care.
The Chicago Schweitzer Fellowship is a national fellowship dedicated to helping graduate students in the health professions pursue a passion project or community project that they're really interested in.
It's a program that supports professionals who really want to improve the lives of their community through community service, through community programming, really addressing health disparities in their area.
You design a project that you think you can dedicate 200 hours to over the course of a year, and then from there you start working with mentors at different sites and mentors within your school, and you come up with a way to somehow improve the health of your community that you want to serve.
I initially started this program just focusing on oral health literacy, but as I moved into the program a little bit more, I realized that a larger issue was access to care. Access to care for older adults, for adults who are low income, is a huge problem. Older adults have a lot of barriers to access to oral health care. Older adults also have many systemic conditions. They have diabetes, they have hypertension, and so these things can impact their oral health status. And so I also wanted to be able to educate older adults about how their oral health and how their systemic health work together.
So my project is dealing with individuals with medical complexities and special needs in the Chicagoland area. Children with medical complexities are the fastest growing pediatric population in the United States, and our healthcare systems aren't necessarily set up to accommodate those individuals. So my personal interest in the project started when I was in college. Before I even knew I wanted to be a dentist, I spent time working as a caregiver for individuals with special needs. I started seeing that a lot of these children and adults did not have access to oral health care. Not just because they were living in rural parts of Wisconsin, but because the healthcare system wasn't set up to see them and dentists weren't comfortable seeing them.
It's a great feeling to see the outcomes of what I've done. So I get to see how so many different factors, health, social, economic factors, all play into the individual. And so for me, that's really important to get it out to other professionals, get it out to politicians, our government officials. It's really important to share those stories so that we can really make a change with the system of healthcare as it is today.
There's a lot of different ways in which oral health is a part of primary care, and I think that my project has really tried to integrate those two groups, oral health, primary care, in the special needs population, which isn't often done.
If a student is really interested in applying for the Schweitzer program, really try to find a health topic that you are passionate about and really enjoy, and that you really see a gap that needs to be filled.
Start reaching out to faculty at the school that you know are also interested in the same kind of project as you.
Also, continue to do community service. If you're interested in the Schweitzer program, I assume that you're somebody who's interested in community service, interested in public health. Really start to show that. Really start going to community service events, participating in oral health information events as well, really getting involved in the community. UIC has a lot of opportunities for students to get involved in the Chicagoland area.